Dr. Ruffing, I'm going to close out this scrolling deck and open up the formal presentation. Good afternoon, everybody. Welcome to the Region 5 for Kids showcase of an extended downtime toolkit for healthcare coalitions. At this time, I'd like to invite Dr. Ron Ruffing for a few opening comments. Dr. Ruffing, you're muted.
Damian, thank you. I'm Ron Ruffing. I'm a retired now pediatric emergency medicine physician, and I work with Region 5 for Kids as the leader for their drills and exercises and deployable assets work group. Region 5 for Kids is an ASPR-funded pediatric center of excellence, one of three that exist in the U.S. And we work in the upper Midwest in the states of Wisconsin, Minnesota, Illinois, Indiana, Michigan, and Ohio. We've been doing this work for the past 7 years, and it's really our pleasure to present to you some work that we've been doing with healthcare coalitions. This work or this presentation is one of three showcase presentations that we have developed. This is the second one in a series that grew out of a presentation and a workshop that we did on cybersecurity. Healthcare coalitions that were present at that meeting were presented with a toolkit to help them work on their hospital preparedness program requirements for cybersecurity, for extended downtime, and for patient movement. This is the second. At that workshop, there was actually a request to present a toolkit on extended downtime, and that's what prompted us to undertake this particular activity. So we are excited to be here today. We welcome all of you, and we do hope that this work that we've done does assist you in your work in healthcare coalitions. We have found that our work in improving preparedness for children has been definitely augmented by working with healthcare coalitions, and we, undertake this activity as part of that work and look forward to continuing to work strongly with healthcare coalitions in the future. So thank you for joining us today. It's really our pleasure to have you here, and we do hope that you find this valuable. Damian, back to you.
Dr. Ruffing, did you want to introduce Region 5 for Kids?
I did sort of a hint at that Region 5 for Kids are the states identified there on the slide. I think I touched on most of these things in my opening remarks.
Perfect. Thank you. So good morning, everybody, or good afternoon, everybody. Good morning if you're on the West Coast. I'm Damon Seawick, a project manager for Region 5 for Kids Pediatric Disaster Center of Excellence. Just a little bit of administrative information, a little bit of webinar etiquette. The webinar is being recorded. We usually turn around and have it posted to our website within about 48 hours. The webinar question and answer feature is the preferred form to ask questions. After the presentation of the toolkit, there will be a time set aside for question and answer period. Within the webinar platform, the attendees should be able to view and upvote questions of interest that they may have that someone else submitted. And throughout the course of the showcase, we will be sharing several QR codes to access the toolkit itself and for potential registration of another activity. If you're interested in those, please have a smartphone or camera handy to read a QR code. Of course, Region 5 for Kids Pediatric Disaster Center of Excellence is funded by ASPR. Everything we present today is the opinion and views of the presenters and Region 5 for Kids and does not necessarily represent the views of ASPR, Health and Human Services, nor the federal government. Additionally, we recognize ASPR has tools and materials related to extended downtime available on the ASPR Tracy website. We offer this particular toolkit, and we view this particular toolkit as a supplement and added value to existing ASPR resources. For those interested in accessing and following the opening and following along with the toolkit throughout the presentation, this QR code will take you to a Region 5 for Kids webpage where you can access and open the toolkit and follow along as we go through our presentation. I'm going to linger on this slide for a couple minutes to allow folks to QR code and open at their convenience. And while we're waiting, I wanted to provide some background and assumptions baked into this particular toolkit that, as we mentioned, it's designed and developed for healthcare coalitions. Here at Region 5 for Kids, we have learned and recognized that all healthcare coalitions are fairly unique in their jurisdiction, their geographical span, their population types, their population densities, their funding mechanisms, and available resources. And with that, we designed this toolkit to be very much of a useful for all, but unfortunately, it may not meet the specific requirements of every healthcare coalition that attempts to use it. More of a one-size-fits-all versus custom fit. We also adopted the point of view or the concept of the jurisdictional healthcare coalition when developing this particular toolkit. And by that, we mean the actual healthcare coalition organization itself, staff, office, and policies, as well as all of their partner members within their jurisdiction, i.e. the larger concept of the healthcare coalition. And that'll be important later on as we describe and flesh out this toolkit and why it is set up and ask questions in a certain manner. So once again, the toolkit is sort of designed to meet the needs of the healthcare coalition writ large, not necessarily the management of the organization. And I do want to take one more extra second here to our assumptions about healthcare coalitions. It's really much more of a belief or a policy. At Region 5 for Kids, we believe that engaging our healthcare coalitions is a force multiplier for the work of both the Pediatric Disaster Center of Excellence as well as the healthcare coalitions. We like working and partnering with our healthcare coalitions here in Region 5 for Kids. Hence, a toolkit at their request for a specific topic, as Dr. Ruffing alluded to earlier. And with that, here's our first look at sort of the toolkit itself. You can see sort of the cover as well as the table of contents. And as you can see from the table of contents, the toolkit in and of itself, the overarching toolkit, has three key components, which would be an extended downtime assessment form, an extended downtime support planning template, as well as an extended downtime tabletop exercise template. Plus 6 additional appendices with additional information as related to extended downtime. In total, it's 47 pages. The assessment itself is 11 pages. The plan is 9. And of course, the tabletop exercise is 12 pages. A couple of descriptors or unique aspects that we feel of this particular toolkit. Number one, that concept, it's written for the idea of a healthcare coalition jurisdiction, not necessarily just the office concept. It does contain templates and forms and tools for the 3 aspects of extended downtime that are baked into the current ASPR Hospital Preparedness Program Cooperative Agreement. By that, I mean to say it's the assessment plus a support planning template plus tabletop exercise template. When we open up in a few seconds here, we're going to open up the toolkit in of itself. You will see it is a Word file, a Word document, 100% able to be edited by the Healthcare Coalition. There's opportunities to add logos and branding, to add text or paragraphs or content that Healthcare Coalition may wish to do, as well as the opportunity to delete things that may not be appropriate or wanted at the local level. The toolkit closely comports with the language and requirements of the cooperative agreement. Specifically, it holds tight to the ASPR definition of extended downtime, which we will circle back to in a minute here. The point being that as sort of guardrails for the project, the language of the cooperative agreement is really what's driving the content of the toolkit in and of itself. As mentioned earlier, we don't view this in competition with any other materials that are available, but much more as additive value to existing resources. With this particular slide, this sort of infographic, what I'm attempting to convey to the group is sort of the format or the structure of the assessment in and of itself. As I mentioned, it is 11 pages long. And when you're looking at the document, what I'm presenting here is hard to see. It's sort of the outline. On the left-hand side of the slide, we have the 1 through 4 communications, information sharing, resource management, and other key healthcare systems, specific requirements out of the cooperative agreement to be assessed by ASPR. The next column over, there's a repetitive series of 14 questions baked into each one of those 4 topics. And then columns 3 and 4, and actually 5 within the toolkit, is an opportunity for the Healthcare Coalition to determine which communication system they want to assess, prioritize, and assess first, and a second, and a third, and even a 4th or 5th or 6th if a Healthcare Coalition is interested in doing so. Once again, when we open up the toolkit itself, the sort of structure won't be as readily apparent because it's spread across 11 pages. But as you can see, for each of the 4 key topic areas, that 14 questions is a little bit repetitive. And that's sort of by design to make sure that each component is discussed and evaluated. So I'd ask you to bear with me for 1 minute here. I'm going to close out this PowerPoint presentation and open up the document in and of itself. And so once again, we're sort of looking at the cover of the Extended Downtime Toolkit for Healthcare Coalitions. The toolkit writ large is based loosely on the format and structure of HCEP materials, but adjusted to accommodate for toolkit in and of itself. We saw the table of contents, and I want to speak to those a little bit more before moving on. As mentioned, the toolkit has a form for an assessment, a template for support planning, and a template for a tabletop exercise. Also baked into the toolkit are 6 appendices of important extended downtime information and resources. The first one being the Health and Human Services Cybersecurity Program. And we chose and included that in the group as a resource because of its relationship with extended downtime. Over the course of this particular project and a previous project with extended downtime with cybersecurity, we have come to learn, it is very self-evident that work with an extended downtime is almost hand in glove with work with cybersecurity, with one oftentimes leading into another. Researching and developing the toolkit, researching health and human services, there is not necessarily a strong, robust extended downtime program that there is within ASPR. However, the extended downtime content does fall under the auspice or the range or the authority of Health and Human Services Cybersecurity Program. So that's sort of why that resource is included. We did also include the ASPR Healthcare Preparedness and Response capabilities with the 4 key responsibilities baked throughout the document, in the assessment, in the plan, and most importantly, in the exercise. The third appendix is, of course, the ASPR Hospital Preparedness Program Extended Downtime Activities, not the full cooperative agreement, but just the components out of the cooperative agreement that relate to extended downtime. We provide 4 additional resources in Appendix D. In Appendix E, a little bit of a gold nugget from past experience of an extended downtime event that I will describe further. And of course, the traditional terms, definitions, and acronyms, all baked into the overarching toolkit. As we look through the toolkit, you will see there are some areas that are highlighted yellow. Those would be areas where the Healthcare Coalition could quite literally just copy and paste their organizational name and sort of take ownership of the document if so inclined to do so. So as I'm working through the toolkit and you see sections of yellow, it's just where opportunities for healthcare coalitions to input their name or add specific information unique to their location. As Dr. Ruffing mentioned early on in the introduction, this particular toolkit, the extended downtime toolkit, really grew out of a direct request from our healthcare coalition partners here in Region 5 for Kids. Earlier in the year, we facilitated a 2-day workshop for cybersecurity, and everybody in the audience raised their hand and says, we would like this for extended downtime. So therefore, we now have this for extended downtime. One other sort of Region 5 for Kids practice that is baked into the toolkit and more specifically into the assessment is the preference and recognition of in-person activity, engagement, partnership, or work, that in-person being a lot more valuable than sort of a survey that someone fills out and submits or other methods for conducting a extended downtime assessment. So when we get to the assessment, I'm going to explain that it's really set up and designed to facilitate a conversation of partners within your healthcare coalition. And so before we get to the assessment, just a little bit of information, 5 paragraphs to sort of set up the toolkit. Of course, the purpose, which we've highlighted with the title of the document, Extended Downtime Toolkit for Healthcare Coalitions. The selective content, not so much as with cybersecurity, but within ASPR's library of extended downtime content. A lot of information available, a lot of information not necessarily applicable to a healthcare coalition. So we did go through and curate the content available and highlight and leverage the content for healthcare coalitions and bake that into the toolkit. As with everything nowadays, the life cycle of information as it relates to extended downtime is likely to expire or age out quickly, 2-3 years. So we have that one paragraph to sort of highlight before using the toolkit well beyond today's date. Consider going back and verifying all of the resource materials. We did address the funding statement earlier in the at the beginning, and I do want to take a little time and talk about business continuity. And with business continuity, I'm actually going to be talking about 3 different terms. Of course, business continuity, the extended downtime, and cybersecurity, and recognizing that they really interrelate and there may be duplicative work across the 3. So as going through the extended downtime assessment, you may identify a gap and then recognize, but we've already fixed it with this plan over here. So from the ASPR HPP Cooperative Agreement, they did provide a definition of downtime as being periods when all or part of an electronic system, network, hardware, or software is unavailable or offline. Within that term and definition, extended downtime, as mentioned, it is a bit of a ASPR-centric concept and term. Outside of ASPR, outside of the healthcare industry, extended downtime, there's not much content or use for that sort of orientation or consideration. However, in the private sector, business continuity is how they address those loss of electronic systems, networks, hardware, and software. So the thought being that a healthcare coalition engaging its hospital partners, if you ask them an extended downtime question, just sort of be receptive and open to a business continuity response. Maybe a bit of different language between the 2 groups. And also recognize that your partners, if you identify a gap through the extensive downtime assessment, your partners may already have a plan to address that, but they call it business continuity and not necessarily extended downtime. I do also want to sort of circle back and recognize that there is overlap between business continuity, extended downtime, and cybersecurity. There is, from the ASPR perspective of the cooperative agreement, there is strong relationship between cybersecurity and extended downtime. That sort of hand in glove relationship, with one quite often leading into the other. And just sort of recognize that in theory, work done, already completed, and plans developed to address a cybersecurity issue may address something revealed during an extended downtime assessment. And with that, let's segue on and look first at the assessment itself. Once again, this is designed as a form. As we get deeper into the document, you may recognize that structure I attempted to present in the slide deck. It is a Word document. Everything here you can edit, add, delete, add logos, place in Healthcare Coalition name, and sort of take ownership of it and have the document itself. The goal, of course, is to facilitate that assessment. As I mentioned before, Region 5 for Kids values that in-person, face-to-face engagement of partners. So this particular form is designed to be used to convene an audience, work through the form, have discussion, answer the questions, identify those gaps, consider mitigation, and facilitate a sort of in-person assessment. Of course, it could be handled by Zoom as well, but not necessarily. It's not designed to be a survey that you email to an audience and everybody responds to individually. The standards, I think we've talked about already. We honored very closely the requirements out of the ASPR Hospital Preparedness Program Cooperative Agreement. So we see that as a bit of a standard for the assessment, as well as that Health and Human Services, cybersecurity, CPGs, as sort of an overarching electronic policy applicable to the assessment. So this is just be clearly familiar with, for the audience, just your healthcare name, date, description, and who attended the meeting, whomever you invited, be it in person or Zoom, or maybe it's just a half hour or of a quarterly meeting, something along those lines. We did want to call out the idea that this assessment, we attempted to take it a step further and bake in conversations immediately about a mitigation strategy if a gap is identified during the assessment, with the idea that, of course, that mitigation strategy gets folded over and baked into the follow-on support plan. So those four essential systems: the communications, the information sharing, the resource management, and those other key healthcare systems. First one being communications. You can see the left-hand column, it's a series of questions. And then the other three columns where you could pencil in, we want to discuss for communications, let's just say satellite phone capabilities, because your healthcare coalition prioritizes that. So you could just pencil that in and work through the questions to address the writ large, the capability of your partner's ability to communicate via satellite. Once again, that writ large conversation. If you're a healthcare coalition, let's just say you have 100 partners and 99 of them have great satellite communication programs, you work through the questions real quick and conclude that it's not necessarily an issue. However, if only 50% of your coalition partners have satellite communications capabilities, then there might be an opportunity for the healthcare coalition to identify a mitigation strategy and take action. I'm going to scroll through these questions pretty quick. I'm assuming the professionals within the audience are going to be able to pick up what's being laid down Each of these questions is driven specifically by a point or a requirement out of, once again, the ASPR HPP Cooperative Agreement. So the idea, question one, failure of this particular system, will it affect another system? Within the healthcare industry, we recognize the integration of so many systems. One fails and may pull down others. The next two questions, straight out of the cooperative agreement, consider its impact upon clinical operations. Consider its impact upon operational operations functions. And you can see each of these questions are designed to be a yes or no. So although it's 14 questions, the conversation could go pretty quickly to assess that satellite communications capability. Will the loss of the system affect operational functions of organizations within the healthcare coalition? I.e., if all your hospitals can't communicate by satellite, is that going to impact business? If there's backup systems, maybe not, but that'd be a conversation point. Is the system integrated universally throughout the healthcare coalition? I.e., do all your healthcare coalitions operate on, use the same electronic medical record system, or are there two or three different systems within your healthcare coalition? And I'm circling back a little bit to what we described before is our existing healthcare coalition mitigation strategies for the loss of that system already in place. Satellite communication capability might already be addressed and covered in a communications plan and annex, or maybe already covered under a continuity of operations plan. So that's what that question is trying to identify. If no, it's a new, unique gap. Are additional healthcare mitigation strategies needed for that satellite phone capability that we mentioned? If the reason is all satellites are down, the healthcare coalition is not going to be able to impact that. However, if the reason is two or three hospitals uniquely are offline and could benefit from having a dozen satellite phones on site, that might be something a healthcare coalition could potentially cover down on. So sort of that question, is it within the scope and span of healthcare coalition responsibilities? If yes, what mitigation strategies? And on those three lines where you could write in mitigation, the strategies to mitigate whatever that gap was. Our healthcare coalition resources available for responding to that extended downtime? Yes or no? If no, is that lack of response a responsibility of healthcare coalition within the capabilities of the healthcare coalition? And if yes, potentially list that resource gap that a healthcare coalition could address. Once again, do existing plans support reporting and escalating the system's extended downtime to state partners? From an extended downtime perspective, maybe not. From your communications or your reporting plan, that may already be covered. Are state resources available? Yes or no? If yes, likely just put in the state agency that would be responsible for supporting whatever system was offline. And of course, a repetitive question from the federal perspective: are federal resources available? A lot as you've witnessed, quite a few of those questions were yes, no. Some of them are designed to prompt conversation or consideration, discussion about gaps, and identify potential mitigation strategies, and record all that for each of the systems that's under consideration. Of the four, number two, information sharing. And here's where I mentioned it does get repetitive and it seems very long, and it is repetitive, but quite a bit of this is just yes or no questions for group consideration. And in that conversation, you would likely go through these questions pretty rapidly. With a fourth section, once again, being other key healthcare systems. And in the cooperative agreement, ASPR call out potentially telehealth as a uniquely healthcare system to consider for assessment. And as mentioned before, this form is 100% available to be edited by the Healthcare Coalition. Add delete as needed. And the final two question for the extended downtime assessment is, of course, the community of impact. The question number one, I guarantee you've seen before, already have a copy and paste answer, a description of the communities within your healthcare coalition most impacted by disaster. And then question number two, how would an extended downtime impact that particular community? And with that, this is the last page of the assessment in and of itself. I'll take a brief question and a breath and look to share to see if there's any burning questions about the assessment. Okay. So that was the assessment. And once again, we sort of built the toolkit so that one feeds the assessment feeds into a support plan, which then of course feeds into the tabletop exercise template. The support plan, we based it and structured it upon an example of a healthcare coalition's planning annex. It probably can be the pattern and information very familiar to the professionals in the audience. Once again, everything yellow is what a healthcare coalition could update and add up to amend and make the template their own. Place for a logo, date, time, healthcare coalition designation. Table of contents for the support plan. And once again, this is a template or an overarching outline. Your healthcare coalition may need an additional topic or may not need something that's been baked into the current template. Of course, an introduction, concept of operations, additional considerations, and appendices, with the appendix being that assessment that was presented in just a few minutes ago. Conduct assessment, copy and paste it into your plan as an appendix. I'm going to go through this support plan a little bit quicker, assuming professionals in the audience are going to be very familiar with what's being presented, just based upon experience. So, of course, the introduction, the purpose of the plan, the scope of the plan, and the background and overview of the healthcare coalition, sort of that description of your healthcare coalition again, and description of your membership with all of those bullet points. Planning assumptions, we did bake in and put some specific extended downtime flavor to the assumptions. Number one, recognizing that although a hospital is within your healthcare coalition, a hospital or every organization does have an inherent responsibility for their own extended downtime / business continuity planning, which is bullet number two. Their extended downtimes might be called business continuity. Bullet number three, the extended downtime plan operates in the mitigation, preparedness, and response. And what we said before with bullet number four, a gap and mitigation for anything revealed by the extended downtime assessment may already have been addressed with other plans. And you can see at your convenience, read the additional follow-on bullet points there. Concept of support operations, once again, likely very familiar to the audience. The evaluate, the prioritize, plan, address the gaps, and mitigate disruptions. With the evaluate, which identified in the previous form, assess the use of extended downtime practices, describe community impact, and identified mitigation strategies. Prioritize, and once again, this can be at the discretion and the expertise of each individual healthcare coalition based upon the assessment. This is gap concern number one, number two, and number three, and identify which ones to sort of address with the plan. Some various high impact activities that could be used to address the specific gap. And we added a few here specifically for, these are recommendations or options specifically for extended downtime. Of course, potentially develop redundancies in those various systems, communication systems, redundancies in applications, platforms, develop alternate channels and methods to conduct that activity and sustain delivery of healthcare, implement a cyclical schedule of vulnerability assessments, and reevaluate, test, and improve existing surge plans with the idea that an extended downtime event may cause a surge or a surge like situation for the hospital being impacted, which, of course, the Healthcare Coalition would then seek to address. And mitigate disruptions. A handful of options, once again, baked for extended downtime. Once again, at the discretion and based upon the expertise of the Healthcare Coalition leadership, deploying resources, developing practices to maintain operations, activating surge plans to assist a decompressed hospital that may be overwhelmed due to the event, coordinating patient movement, reporting and escalating up the chain of command, and of course, that conduct, analyze, and report essential elements of information up through state and federal partners. Additional considerations. This one is really circling back to that cybersecurity aspect, with the idea that quite often cybersecurity event leads into an extended downtime event. Ergo, extended downtime needs to keep an eye on what's happening in the cyber world, which is pretty much the situational awareness paragraph. And of course, just sort of developing some communications practices around extended downtime to keep the Healthcare Coalition updated and aware of extended downtime gaps, mitigation strategies, and general information. Then the healthcare opportunity for the Healthcare Coalition to add that previous assessment as an appendix to the plan if they so desire. And with this is the last page of the support plan, extended downtime support plan. And with that, I'll take a breath, a drink, and look to Sherry, see if there's a high level question.
There are no questions.
Thank you. And that takes us into the extended downtime tabletop exercise for healthcare and public sector tabletop template. Once again, I'm going to lean into the expertise of the audience and cruise through this pretty quickly, just calling out a few key points that are unique from the extended downtime perspective. The situation manual is crafted in accordance with HC program, and beginning with an exercise overview. Everything in here should be fairly familiar to the group. I would call out that we did use the ASPR, Healthcare Preparedness and Response Capabilities for Healthcare Coalitions, as sort of the goal of the exercise, with those 4 capabilities listed. Conceptually, we did put in 5 objectives to sort of structure a tabletop exercise. Begin with a little education about the assessment, a little education about the current plan, Healthcare Coalition plan, set up 2 iterations of scenarios, 80 minutes in total, call out, or at least try to identify 6 mitigation strategies from the Healthcare Coalition perspective, and of course, the traditional post-event hot wash. Scenarios, we did not bake in scenarios into the tabletop template, simply because the scenarios should be driven by the Healthcare Coalition's priorities and gaps. To say that this is the scenario for all healthcare coalitions would not necessarily be appropriate from where we sit. And then, of course, the rest of the situation manual, general information. We did add in an additional paragraph, building resilience, which quite literally we stole out of cybersecurity, with the idea that that's the real goal behind extended downtime, is to plan and prepare and to build that resiliency within your organizations so they can respond, do some sort of extended downtime activity. Exercise objectives and capabilities, the crosswalk between the exercise objectives and those ASPR preparedness and response capabilities. Participant roles, exercise structure, exercise guidelines, exercise evaluation, should all be familiar paragraphs. Module 1 and Module 2, we did bake in 2 modules with the idea of potentially 2 iterations of scenarios. Once again, everything in yellow for Healthcare Coalition to modify at their convenience. The vast majority of this information, it comports with the HCP program. We did develop a small list of questions to ask to facilitate conversation. But they're a little bit generic in that these questions, we don't know what system's offline due to the scenario. But which communication system is offline? Are these systems integrated? Are they used for the delivery of healthcare? Are they operational? A little bit repetitive to those questions we asked in the assessment. Pretty much a duplicate for Module 2, the traditional exercise schedule, which, as I sort of mentioned before, a little bit of educations, a couple of scenarios, full group conversations as part of those scenarios, and then the end of event hot wash. Exercise participants, the ASPR Healthcare Preparedness Response Capabilities, just to include those as the sort of standard for the exercise, and acronyms, and that is the last page of the tabletop exercise templates. Very familiar, hopefully very familiar to the group. Once again, based upon that HCP planning model. A lot of input required by the Healthcare Coalition in order to customize the exercise to their goals, gaps, needs, and responsibilities. So I'm just going to cruise, and we're getting there on time. I'm going to cruise through real quick some appendices in the overarching toolkit. I do want to call out one little odd quirk in our toolkit, in that this Appendix D is the last appendix of the situation manual for the tabletop exercise, and then we jump into an Appendix A of the larger toolkit in and of itself. This is the Health and Human Services Cybersecurity Program, a little bit of information and a link to their source, with the idea that extended downtime sort of falls under the auspice of Health and Human Service Cybersecurity Policy. Those ASPR Healthcare Preparedness and Response Capabilities. The ASPR Hospital Preparedness Program, once again, this is not the full document. We identified and called out those 3 sections related specifically to extended downtime for the assessment, the plan, and the tabletop, just so toolkit users could have those handy and available. These 4 resources, all ASPR, all related to either ASPR policy or ASPR extended downtime policy. The vast majority of these, I'm sure the audience is already well aware of. The first one is just a link to that care, preparedness, and response capabilities we just saw a second ago. The ASPR Tracy site that has all the resources available for healthcare coalitions. The ASPR Tracy Healthcare Coalition Extended Downtime Healthcare Delivery Impact Statement, their version of an assessment for extended downtime. And of course, there's one additional ASPR topic collection as it relates to the EHR and downtime procedures, which seem to be the previous generation thought about extended downtime. So we added that in there as a bit of a look backwards about extended downtime. I do want to take a minute and explain Appendix E. And this sort of grew out of our cybersecurity experience and commentary from a previous showcase, with the questioner lamenting and recognizing that a hospital that has had a cybersecurity incident and gone through extended downtime, very tight with information, they don't share, there's no lessons learned, not very helpful. We understand that liability, legal reasons, not really going to come. But we did have one of our partners that was able to share just one golden nugget from their experience. And that was sort of the impact of staff who are no longer functional in their primary duties because of a cyber or extended downtime incident. What do you do? It was a big lesson on their end, and a lot of in the moment adjustments and reconsiderations to leverage resources for that situation. So this particular appendix, the roles for non-clinician staff during extended downtime, It's short, bullet pointed, and direct to the point with some guidance and takeaways. A quick and easy read, would recommend it. Terms and acronyms, we defined business continuity, extended downtime, and of course, the traditional acronyms at the end of every document. And with that, please bear with me for a minute as I close out of the full toolkit and segue back into a PowerPoint presentation. And Sherry, I'm going to be looking at you in just a minute here. Okay, let the fun begin.
Okay. Can you see the Q&A at all?
I cannot.
Okay. So Dr. Lozon has commented that this addition of roles for non-clinical staff during an extended downtime is a great idea. Planning and potentially training ahead of time is important. Some templated job action sheets could prepare for those roles. I think it's more of a next steps and in addition to the toolkit.
Thank you. Is that the questions?
That is it.
All right. For the full group, once again, if you're interested, the recording for this webinar, this showcase, will be posted to the Region 5 for Kids website, ideally within 48 hours. If you're interested in accessing and using the extended downtime toolkit, here is the QR code and sort of where it's located on the Region 5 for Kids web page. When you open the QR code, it opens for you. This particular showcase is at the top of the page, and so the resource should be there, as well as the presentation. And any follow-on questions, any Q&A that are presented will be addressed and added to the website as well sometime in the future.
Damien?
There is one more. Oops, sorry,
Sorry.
Dr. Ruffing.
Yeah, I just wondered, do we have anybody that would want to ask a question? We got a couple of minutes. Is there somebody in our audience that would like to ask a question? Can we do that at all, or?
In the webinar format, in order to speak, we have to elevate them to a panelist role.
Yeah.
All right.
I do, Dr. Ruffing, one question is in the chat, just is there any problem using the TTX as a functional exercise?
No.
No.
It could serve as for the planner, it could serve as a potential template to plan and develop a functional exercise, but in and of itself, it's not necessarily designed or set up as a functional. It's much more designed as a tabletop discussion exercise.
I'm going to go for a minute here, but if folks would like to reach out to you and Dr. Ruffing for some guidance, is that okay?
Sure, yes.
Okay. And then there were just a couple of comments. Thank you. And then thank you for the full coverage with the brevity associated with the depth of this topic.
So I would just like to take one opportunity to sort of promote a follow-on activity. Third in our series, as Dr. Ruffing mentioned at the beginning, we are developing a similar toolkit for the patient movement and load balancing activities as required in the ASPR HPP Cooperative Agreement. That toolkit is a little more challenging, so we're giving ourselves a longer leeway to develop it. But if you're interested in registering and attending and potentially using that toolkit, this QR code will take you to registrations for an 18 March showcase. And with that, Dr. Ruffing, any final comments?
The only thing that I would say really is thank you for participating. We do hope that people find this information useful, and any feedback is always welcome about how you might use this, how might we improve this, and thank you for your time today.
And with that, thank you, everybody. The showcase is over. I'm going to leave it open for a few more minutes with that QR code to the March showcase if folks are interested. Otherwise, thank you for your time and interest in our extended downtime showcase for Region 5 for Kids.